All right, we're going to go ahead and get started. Welcome, everybody. Welcome to our provider case manager training. Oh. All right. I'm excited to introduce you guys to our training session for Colorado Nurse Assessor and Skilled Care Acuity Assessment Program. I'm Stacy Farrell. I am the clinical implementation lead for this project, and I'll be guiding you through this training today. We're thrilled to partner with the state of Colorado to create a streamlined, user-friendly process for member acuity assessments. So as we launch this new program, we're focusing on training the providers and case managers who will be referring members. Once we complete today's session, you'll have comprehensive training materials to support your role as a provider, case manager for the program, plus a helpful tip sheet for setting up your MFA. To keep our session organized and efficient, we encourage you to post any questions you have in the chat and we'll address them all at the end of our time together. And if we cannot, we will create a document for you. All right, hand it over to Cassie.
Good morning, everybody. My name is Cassandra Keller, and I'm with the Department of Healthcare Policy and Financing in our Office of Community Living, and I am one of the project leads for the Nurse Assessor program here at HCPA. Before we get into the nitty-gritty details about the referral process and how you navigate the Qualitrac system, I just wanted to do a little bit of level setting on exactly what the Nurse Assessor is. I am hopeful you have heard about this project and you have some sense of what it is we're trying to do, but just making sure we're all working off the same info here. The Nurse Assessor is a new process that's going to streamline the way members are assessed and then receive recommendations for skilled care services. That's going to be care provided by a registered nurse, a licensed practical nurse, a certified nursing assistant, and then through an attendant for health maintenance activities. The Department of Healthcare Policy and Financing, HCPF, is going to be holistically assessing members utilizing our vendor, Telegen, and their skilled nurse assessor for the appropriate level of skilled care services across the selected service modalities. So the skilled nurse assessor is also going to be helping to educate about the skilled care services and all their various delivery options. That includes self-direction, and helps to ensure members have an understanding of the services that will best meet their needs based on this assessment. So really helping folks have an understanding of what their service options are that are available to them and what service would best meet the needs that are identified in this assessment. Next slide, please. So who does this apply to? So a referral for the skilled care acuity assessment to Telegen is required for any member who is currently utilizing or is going to utilize any type of skilled care service. This includes services of long-term home health, private duty nursing, and health maintenance activities. I already saw a question in the chat about, does this apply to personal care and homemaker? The answer is no. You are not going to make a referral for personal care and homemaker to the nurse assessor. It is only for skilled care services. As a case management agency, and this also goes to our providers, this assessment is a required component of the prior authorization request, the PAR process. You cannot move forward with creating or requesting a PAR without a completed nurse assessment and that subsequent recommendation letter from Telegen. This must be completed before you move on to create the PAR in the interchange bridge system. Next slide, please.
All right, this is me. Just a little bit of housekeeping and again, some sort of level set. So Qualitrac registrations, because I know a lot of people have been asking about them. Your requests have been received. All access will be granted at midnight on 8/1, and then your AOs will have to set you guys up that morning. In reference to saying the word provider, which I've known has caused a little bit of heartache through the sessions, a provider in Qualitrac refers to anybody external to Telegen. So if you're a primary physician, case manager, home health agency, we refer to all of you as providers because you get the provider role. So if you hear the word provider, I'm really addressing case management also. as we go through the information, some of you have already used Qualitrac before for utilization management for one of the other services um, that we provide in the state of Colorado. This is the exact same system. You won't have to, it's not a different system. Um, you'll just now see the addition of the assessment work. And just to make sure that you guys all understand, I know this is a lot of information. It's an hour's worth of, you're going to click here, click here, click here. But in the end, once you are able to go in and just submit a referral, it will be about 5 to 10 minutes to do it max. But we are going to get into the details for both somebody who has never used the system and those who have used the system. And for those that have used the system, it'll be a little refresher. Our agenda today, we did our overview. We're going to talk about our learning objectives, training topics. We'll get into the training. We'll go over some next steps. We have some frequently asked questions that we have collected, and then we'll answer questions that have been put in the chat. So by the end of the session, you'll be able to understand the Qualitrac Provider Portal. You will recognize how to access Qualitrac with MFA, multi-factor authentication. You will navigate, you'll know how to navigate and search for a member, and you'll understand how to submit the referral form. So our topics in order will be in a little introduction to Telligent, a little introduction to Qualitrac, and then we'll jump into the provider portal and how to access it and what you need to do for your multi-factor authentication that is going live on Monday. Then we'll learn about some of the navigating in Qualitrac, how to search for a member, the member hub, the provider panels that you'll see when you log in, and how to request that skilled nurse assessment and complete the referral form and what all the information means and why we did that. And then we'll have some question and answers, and then we'll also have resource for assistance and contact information. So let's jump into talking about who is Telligent if you haven't heard about us. So Telligent, it provides sophisticated analytics and population health management services as well as IT solutions for more than 36 million covered lives in the Medicare, Medicaid, and commercial markets. We have been doing this for over 50 years, providing expertise and solutions that produce measurable, meaningful results. We have over 600 clinical and technical professionals supporting clients nationwide. And our company is 100% employee owned. And you're probably thinking, why is that important? Our employee owners drive our business, our solutions, and our success. So we have a vested interest in making sure that everything goes smoothly. Introduction to Qualitrac. Qualitrac is a web-based health management system. It was built and maintained by a team of clinical and technical experts here at Telligent. We have 24/7 provider access, streamlined review processes with all the necessary information for your referral on one page. We have a secure electronic upload of their clinical documentation, and you have the ability to track progress of your submitted requests. So we all know 8/1 is when this starts. The providers and case managers in Colorado will be submitting a skilled care acuity assessment referrals for the skilled nursing acuity assessment using Qualitrac. So for you to be able to create a referral, you must have a Qualitrac account. If you do not have one, they're going to be your authorized officials, which we've already trained at your organization, will be setting up your accounts that morning, 8/1. If you already have a Qualitrac account, we're gonna show you how to submit a referral, but we're also gonna show you about the MFA that's coming up on Monday. All right, so how to access our portal. So if you've never logged into Qualitrac before, we'll step through what you need to do to set up your account and log in with MFA. And then if you are an existing user, we'll walk through the steps of what you need to do to log in with MFA. Very similar. Just want to make sure everybody is not caught off guard. So a newly registered user in Qualitrac will receive registration email to activate their account. and set up a password. This will come from your authorized official. You'll click that activate account. It will have you set up your password and go through some security stuff, and then it will jump to MFA. Our multi-factor authentication is new. It is going live on Monday. Um, After you set up your password, will be presented with this screen. You'll click continue because our default method is the email, and I'll show you what the email looks like. We also have the ability to set up other forms of authentication, and we do have a tip sheet for that if you're interested, but honestly, the easiest way to do it is to do the email. So when you click that continue button, you're going to get this screen that says, send me an email. We're going to list your email there. The email that's there is what your authorized official put into your user setup. I'll show you the icon where you can go in and change that if that's not the email you want to use, but I'm assuming they're going to use whatever's at your organization that they have on file. It will inform you that you have submitted that email, and then you will go to your email and you will get this email. It's a one-time verification code. And this is why I say it's the easiest, because this little sign in button here, you're going to click it. It's going to take you right into Qualitrac. You've already signed in. It's just verifying, and it will go in. You can also, there's a little 6-digit authenticator at the bottom that you could take this number and put it in there if you'd like to. I don't know why anybody would not use just the sign in, because it's a direct path right into Qualitrac. All right, so if your email wasn't received, after a certain amount of time, the Qualitrac will display you haven't received your email and you could send another one. But please make sure that you're checking your junk mail, any rules or folders you have set up in your email where things might go to it if it says do not reply, however you have your inbox set up. Just make sure you're checking those places, because even if you send another one, if you can't if it's in your junk mail, it's going to continue to go to your junk mail. I have a folder I set up for all of my Telegen do not reply emails, and I have to go digging for it every time I use it. So I set up mine to be my authenticator app, since I use it for everything else. For existing users, it's gonna be the same process. You'll do your normal sign in, username, password, click your sign in button, and you will get, and I noticed this a minute ago, so let me just jump back here. You're gonna get this same thing to say, send me an email. Ooh, hang on. You're gonna get this to say, send me an email. You're gonna click on it, and it's gonna give you that same exact email that says, how do you want to get in here? And you can just click the sign in button, or you can also use the code. So the system automatically defaults to an email for multi-factor authentication. We do have other options such as Authenticator app and phone and text. You will, if you want to set up any other means of authenticating, we have this. We have a tip sheet that's on the Nurse Assessor website for you that will go through all the steps. So let's talk about the provider portal. The Qualitrac landing page where you come to when you log in. So upon successful login, you're going to be taken to this dashboard. You can select either care management, case management, it's care management, and utilization management. All of it takes you to the same place. I know we're doing assessments, but it's the same buttons, same path forward. We are working on a new dashboard. The start task will take you to your task queue. You won't be getting many tasks unless we are requesting information from you. So you probably will not use that often. What you will use is this search. Then there's another way to search too. So I'll talk about that in a second, but that will allow you to search for your member. And then this button is not active. So there's a main navigation ribbon that is always at the top of your screen in Qualitrac. It contains role specific icons for your use, as well as this Qualitrac. It's an icon. It's just the name in the corner, but it's my easy button. We'll go over what each one of these means. But at any point, if you are turned upside down and you don't know where you are within the application or you can't find how to get back somewhere, this Qualitrac logo, you can click on it, it will take you right back to your landing page so you can find your way back. And I'll talk about it being like a tab system. Certain portions of the application open tabs. So that's where I find most people kind of get turned around because they're like, where am I? If you have if you're not sure where you're at and you can't get off that screen, look up, look at your tabs across the top. So what do these icons mean for you? The user way icon is this one, this little man, and this just gives you access to accessibility options. Our system messages is our bell, and if you had messages, there would be numbers here. You could have 1, 2. For those of you that are in Qualitrac right now, there is a banner that you can't remove that tells you that multi-factor authentication is going live on Monday. But this will give you any system messages. If there's a downtime over the weekend, you'll get a system message. Any new release notes, if you wanted to look to see what we do a 2-week release, what's coming out, you'll have access to that. Our magnifying glass is our search option. This little caret here just drops down and gives you the option to search member, case, or provider, and we'll look at that in a second. This is our task queue icon, 3 lines, and that will take you to your task queue, and that's in our banner up here. Our question mark is our knowledge center. You can click on that to access user guides, videos, release notes, and tip sheets that we've created. Just note that they're generic for all clients. So any specific assessment management information will only be available on the Nurse Assessor website related to the Colorado workflow. And the last is our user profile or log out with our little caret here button. This is where if you want to change your name, your phone number, you want to change that it says Stacy Farrell RN, you want to change the email that your notifications go to, you will click on here. It will bring up your user profile. You could change everything except for your username. Your username has to be unique, and that is set up by your authorized official. So a couple other tips and tricks. Like I said, it's a browser tabs. Qualitrac opens them more for convenience as our platform, so it's easy to drag and drop that to another screen. But it is a tab system, so if you don't know where you are, look at the tabs up top, or go back to your Qualitrac icon, your easy button. You may see some paper and pen icons. That means you'll have the ability to edit information. Your asterisk, which you will see a lot, indicates a required field. So some of the other little things you may see, here's our hamburger, our 3 lines. That'll give you more action options. Our ellipsis, which you'll hear me talk about because this will be mostly what you see, will give you also additional actions and options. Our add button is orange, and it's also orange for the referral button. But this just says that you'll have the ability to add information. So you'll see this in our upload documentation sections. You can expand and collapse, not so much your guys' view, but a part of Qualitrac is expanding and collapsing. The provider's panels stay open. The trash can here, sorry, is red, and that indicates that you have the ability to discard or delete content. This is only the content you enter. You can't delete other people's. Conversation bubble. These are attached to our tasks. So if you get a task for additional information sent to you, you'll click on that conversation bubble and it will pop up another modal that will give you some notes and it'll say, we need the 485 for this. And we'll get into some of that in a little bit. And then the last is our hover to discover, our little tooltip. Anywhere you see this, you can kind of hover over it and it'll populate, it'll just bring a little text box up to give you a little bit more information.
Stacy, so sorry to interrupt.
Oh my gosh, I did it again.
Yeah, I don't think we switched slides. Thank you so much.
Sorry, I
Okay.
keep doing that. I have so many screens.
Thank you.
So here it is. Sorry. Here's your hamburger that I talked about, your ellipsis that we'll see, your add button, orange, garbage can, your notes, conversation bubble, and then your hover to discover. Going back to this screen. Sorry about that, guys. Searching for a member. So to execute a search, you're going to go to the navigation ribbon, which is really the easiest way. And you're going to click the little caret, and the caret's going to give you these three options. One other thing that I don't have showing here is that if you've been in a members hub, you'll have the last 5 searches down here. So if you get disconnected while you are in someone's chart/hub, you can just pull down here and it'll list their name at the top. I use that all the time. It's my favorite feature that came out probably about 2 years ago. So to pull up a member, you're going to have to enter members' information. Talk a little bit about our asterisks. They all are required. So it's either or. You can have member ID and date of birth, or first name, last name, and date of birth. The combos have to occur. You can't just type in Stacy Farrell and see every Stacy Farrell in the state of Colorado. You have to have specific information to access these members' hubs. So all members that have Colorado Medicaid eligibility will be searchable in Qualitrac. We get that via a file. If a member is not found, and I know you guys don't use this aspect, but there is a way that we'll be creating a job aid for you to add members. It is not preferred. We do want you to exhaust every other effort before you enter a new member, but most of them should be in there for you. So jumping into the member hub, once you've selected your member, and this is what it'll look like when you get a match, you won't see more than one unless there is some sort of duplication that occurs. And we have our system marries that stuff up in the evenings. Our member hub screen displays member demographics. It will show you an assessment management panel. It will show you member assessments panel, and it'll show you utilization management panel. And we'll get into that. So in the member demographics, you will see basic demographics at the top of your screen. Notice here's our nav bar. Here's your little easy button. It'll give you the member name, member ID, date of birth, phone number. And if you wanted more information like their address, you can click on this button here, and this will give you additional member details. This is what it looks like expanded. We'll give you their preferences if they have multiple phone numbers. The star indicates that that's where they prefer to be called. Any preferable contact information. If you want to look for eligibility information or policy plan information, you can click on this yellow hyperlink, or there's an view even more member details. It's not really a button, it's just kind of at the bottom in that bar. If you click on that, it will bring you to this screen. This screen just gives you a general overview, plus gives you eligibility information that we get on the file from the state of Colorado. It will give you demographic information, any identifiers, such as social security number, Medicaid ID, all the stuff that comes over in the file will populate. Again, any member info, and then here's where you'll find policy and plan information if you need to check, and then also contact information history. So after a year or so, you'll be able to see how many times a member has said to us that they have a new address, if they have a new phone number, or their email has changed, by chance if you need it. I don't see you guys using it much because you have your own system, but I just want to make sure you're aware. So let's jump into what you're going to see in the provider panels once you search for your member. So once you've navigated to the member hub, again, member hub is equivalent to something like an electronic medical record would call the patient chart. It's not an official EHR, so we call it our member hub. It's where we house individual members' information. You'll have 3 panels. You'll have, and I have these by importance, but utilization management is actually first when you log in. Assessment management panel. This is where you're going to see all assessments that have been performed on this member, even if you did not request them. The assessments panel at the bottom is just a quick reference for links to documents of assessments. And then the utilization management panel, for those of you who use the system for our UM side of Colorado, you will see cases that you've either entered or cases that your organization has granted you access to. If those two pieces don't qualify, you don't see anything in that panel. So you would not see something from another organization's submission for UM. So let's talk about the assessment management panel, because that's going to be the most important one here for our assessment workflow. You will see you'll see any assessments that have been submitted for the member. So if it was not you, it will show you that there's already been an initial assessment and the date in which they were referred. Clicking the plus sign is going to access a little more information, give you maybe the date of the assessment, copy of the assessment, a hyperlink for it, copy of letters, and we'll look at that next. So once you expand that, and you see now I have red negatives, this is what you're going to see. So you'll have letters listed here. So if any letters that have been sent out will be here. Documents that have been uploaded will be here. You'll have the assessments completed here. So if you needed to look and print off their skilled nursing assessment, you can do that here. We'll talk about printing a little bit later. You can see when their appointment was for their last assessment. If you wanted a little bit more details of the appointment, you can click on this blue hyperlink, but I don't anticipate you guys wanting to know much more than that. So let's jump into what the requests look like, because this is really why you guys are here. You want to see, what do I have to do to get them an assessment so that we can get the services they want? So to request an assessment, you're going to have to log into Qualitrac, search for your member, like we just went through, go to their member hub, and then you're going to locate that assessment management panel that we just reviewed. You're going to click on this portal button here, portal referral, and that is going to bring you into our referral form. It takes you to a different part of Qualitrac, which has a little bit of a different look and feel that you'll see, but functionality, once you complete it, it gets submitted to our intake staff. Before you request an assessment, check the assessment cases for the referrals that are here. If somebody was referred a week ago, you do not need to put in another referral. As we go on in time and the members have had their initial assessment, there may be a reason why you would need to request an additional assessment due to changing conditions. But initially, just take a look. It could have been another agency or a provider that read about it and decided your member needed an assessment. But again, you have the referrals available to see of anyone who has submitted a referral for that member. So the referral form, pretty straightforward. Once you click on that referral button, it will open up. The things that we'll look to collect is member information. We're going to go over each one of these sections. Case management or support coordinator information, assessment and benefits that you're looking to have assessed, supporting documentation section if you have anything you'd like to provide that would support the assessment. The assessment method preference, how you feel like this member should be assessed. And then there'll be a user attestation, and we'll look at all of that. So first is going to be collecting our member information. The first name, last name, phone number, address, Medicaid ID will pull in for this member from the chart, from our hub. We ask if you know that they have a preferred contact method, you can put that in there. If they have a language preference, you can give us the heads up so we can coordinate an interpreter for our initial call. If they need an interpreter, you can select the yes button here, and that will go over to the intake staff. What we ask though is if their phone number is not what you have on record that you contact the member with, or the email is wrong, we would like you to provide us with the most recent information. This is going to help us get the member assessed faster. The second section is our collecting case manager or support coordinator information. This will be you guys. We're asking for your first name, last name, a phone number we can contact you with, and an email address, and what agency you're with or organization. This is so that if we can't get a hold of a member, we're going to try and reach out to you. If you have a relationship with them, you may know a different number, or you may say to them, hey, reach out to the member and say, Telligent's trying to call you to set up your assessment. You need to answer the phone. We have time restrictions based on how many times we're going to try and contact them before we consider it an incomplete assessment. And they'll get notifications. It's 5 days. So anything we can use and anybody that we can use to help, push them towards doing that, scheduling that assessment so that they can get the services that they need. We're just looking for resources. The next section is our assessment and benefits information. So the submitter will choose the desired assessment type and benefit type for that member. You can select more than one benefit types. You can select only one assessment type. We're going to jump into what each one of those means in a second, but they'll just be drop downs for you. So assessment types. We have the initial, which is the first time assessment used to determine the immediate level of care and support needs for this member. All of the referrals that we place initially should be an initial assessment. We would not anticipate or should see any other types of assessment than initial to start. The change of benefit is when there's a clinical change in a condition that may require the change in the services that that member is receiving. And Cassandra will talk a little bit about that in a second. And supporting documentation is required to conduct this type of an assessment. And we can do them expedited. Expedited will give it a shorter time frame that we have to conduct the assessment and have the results for you. So there is criteria for expedited assessments, and Cassandra will talk a little bit about that in just a second. Our express assessments are the initial, after your initial assessment is done, and the next year or within the past year you've had it done, and there's been no changes for that member. This will allow for a quick assessment. We know that there's not really any changes, and they were getting the same services. Doesn't mean it won't change the outcome. It just means that that there's no changes that have happened. There should not be any express assessments submitted initially. They should all be initial assessments. So I'm going to go ahead and hand it to Cassandra.
Thanks, Stacy. Just wanted to provide a little bit more information and details here on the standard versus expedited. We anticipate that most, if like the majority of your referral requests for an assessment are going to fall within that standard time frame. What we're looking at for this, if from once the member has the assessment scheduled, we're only looking at a week, at 7 business days. So it's a very quick turnaround compared to maybe what you might be used to with the back and forth that was occurring when you did health maintenance activities requests with Telligent previously. So we're hopeful that this process is going to be really short and you don't need that expedited assessment. However, in some cases, there might be an urgent medical need. The member is trying to discharge from let's say maybe a nursing facility or a hospital. There is a need to have this assessment done really quickly. You can indicate that. Now, you may not know about something, and so you don't have to necessarily select this option within the referral, but it is there. If you know that there is a reason why an assessment should be expedited, you can make that request, but we ask that that be done sparingly, and for the most part, you're following that standard timeline. Back to you.
All right, and so let's talk a little bit about our benefit types that you have the ability to select. You can select all, you can select one. We're looking for you to indicate what you feel like they need to be assessed for. So private duty nursing, and you guys probably know this more than I do, is the program that provides skilled nursing services on a continuous basis to the HFC members in their place of residence. So that's by a registered nurse or a licensed practical nurse. The long-term home health has 2 options, and that's skilled home health services provided to a member who require ongoing home health services beyond the acute home health period. It can either be CNA or RN. It would be a skilled nurse, registered nurse or an LPN, and then the other would be services by a CNA or nope, by a CNA. Sorry, I'm jumping ahead of myself. Health maintenance activities is the last one, the HMA. These are routine and repetitively skilled health tasks which are necessary for health and normal bodily functions that an individual with a disability would carry out themselves if they were physically able, or if they had family or friends were available. So these activities include tasks typically performed by a CNA or a certified nurse assistant or a licensed nurse, and they do not require clinical assessment or judgment of, of a licensed nurse. All right. So our next section is the uploading of supporting information. To say out the gate, we do not require you to submit uploaded files to us. We don't require it. We're not going to stop you from submitting the referral. This is where we suggest if you have any information that can support the need of the assessment, we ask that you provide it to us. There is one assessment, and we'll talk a little bit about it in a second, that requires information. So again, if you don't upload it, we will come looking for the required documentation. This is our change of benefit. This is an assessment that we talked about, and they have requirements for our documentation. We need a previous plan of care, 485, or any hospital or medical facility discharge summaries, especially if there was hospitalization since their last PAR. We will be providing a job aid for what happens if we need to request that information. So to upload your documentation, I'm going to just skip back one. You're going to click this upload file button. You are going to come in here and you're going to click here to select that file. You have the name of the file will populate here. If it's a name that you want to put more clarification in it, or you got it from an EHR, or like what comes out of our system at times, it's alphabet soup. You want to put information regarding that file, you can change it here. Most people have it named something else when they insert it, but I wanted you just to know if you needed to rename it, you can. We also have categories here. You'll just select a category that best describes the document you're uploading. We have all of the potential documents that we would expect, as well as another category. Next is our assessment methods. So we're asking you to provide us with a preference that you have for the method of conducting the assessment for the member. So we're looking for your advice. You have a relationship with this member. I don't know, is a virtual Teams okay? Or do they specifically need an in-home visit? If they specifically need an in-home visit, we ask that you put the radio button here and you'll get a little pop-up of a text box to enter information to explain why you feel like they need an in-home visit. Just want more information from you, just to make sure that, as we're approaching this, we're approaching it the right way. And the last is our provider attestation. Everyone is required to certify the information that is listed here, that it's accurate and complete to the best of their knowledge. When you sign your attestation, you have to put your Qualitrac username. So it's whatever you use as your username to log in. If you put a space in there, it will give you an error that says you need to use your Qualitrac username. I do this all the time. I put in Farrell and I'm in a hurry and I just keep going and I get an error and I'm like, oh, that's right. I got to put in MD at the end because that's my provider login. It won't let you move forward. And then once you've completed the form, you click submit and this will be routed to our intake staff. They will get notified that it's been submitted. If the members opt to get electronic communications, they will get an email that says we're going to be calling you. But after you've done your part, it carries on into Qualitrac through our assessment management workflow. After your referral is submitted and the assessment is completed, you will get notified. You, the submitter, will be notified that the nurse assessment recommendation is complete. This could be a variety of letters, could be one that is there's a letter for no services, didn't qualify for services. There's a letter with the recommendations from the assessment for the services, and there's also an incomplete. The incomplete is if we could not get a hold of them to schedule this assessment. We have 5 days, and then it will need to be resubmitted. And that's where you come into play. We need your assistance. So once you get that email that says it's been completed, you're going to log into Qualitrac. You're going to go to the member hub for that selected member. You're going to locate that same assessment management panel that we talked about in detail with our little plus signs here. You will then click on your green plus signs and you'll navigate to the letters section. And then you'll also be able to open up the assessment and you'll be able to review those. We'll talk about printing in a second. So what's next? I'll hand it to Cassandra.
Thanks, Stacy. So you're probably thinking, okay, I've gone through this whole rigmarole. You have requested the assessment. The assessment has been completed. The recommendation letter is now in your in the system. You are able to pull that down. Stacy's going to show you in the next few slides how exactly you can print that assessment. But you're going to take this information and then you're going to now finish as a case manager the person-centered support planning process. You will then go over the results with the member and you will complete the PAR request for this member. So you are going to finish that step and back with the member and then in the care and case management system and within the bridge. And we're going to move on to kind of some frequently asked questions in there, but I did want to note going back to the virtual versus in person. So all assessments have to be done what we are calling face-to-face. That can either mean it is done in person or virtually, but it needs to be done over a video screen. Our anticipation is that most members will be able to use that virtual assessment, except for some very specific reasons. Their medical needs are beyond and require someone to be in person. The member has no ability, doesn't have the technology, or cannot use that technology to be able to do it virtually. So it's absolutely, as Anna asked, it's good enough to use for a CSR for health maintenance activities to do it virtually. So that is probably going to be the majority of what these will be. But again, we've been asked, my person doesn't have it. They don't have a computer. They can't not get on a Teams meeting. That's perfectly fine. We can do those in person. Back to you, Stacy.
Thank you. So let's go over, this is our 4th session. So let's go over some of the questions that we've been asked. And the first one is about, we're getting that assessment and letter and trying to print it. So as a referrer, will I have access to the completed and scored assessment? Yes. You will have access to that assessment and the letters. To print the completed assessment, you will go to the appropriate case for the member, and you're going to click on that blue hyperlink for the assessment, and you're going right at the top in the skilled nursing assessment bar is this little print button. You will print that, click that button, and it will give you the options to print. If you're connected to a printer, you'll be able to do that, or you might have to print to PDF and store it. To print a letter, you will go to the appropriate case for the member, and there's also a blue hyperlink. And then when you open that letter up, at this top bar above the letter, you'll see this little print. It's a little printer. And you'll click on that, and that'll give you options to either print to PDF, print to if you're connected to a printer. Some of the other questions is Qualitrac set up to indicate whether this is a duplicate referral? Yes and no. We're working on a solution right now, which should be out within the next few weeks, to give you a pop-up that says there's already been a referral submitted. So in the future, you will have that. But as we start out, we're asking that you just look at the cases. If you have a recent initial assessment that's been submitted, you likely don't have to submit another. If it's completed, you might be able to, you'll access that information. And then I don't need to do this one, right, Cassandra?
No. So this one's specific to health maintenance, or excuse me, to home health agency. So we can skip that one.
Okay.
Stacy, before you wrap up, I just wanted to note a couple of things. As was asked in the chat about, is this relevant? This is absolutely, this is going to be the very specific information on how you're going to submit that referral. But as I noted earlier, there's going to be a case management specific training that will be hosted by HCPF. That's going to give you a lot more details of, if I need to upload this letter, where exactly do I do it in the care and case management system? How do I, if there's an appeal, how do I do that? So there's going to be a lot more information to the specific case management functions. This training is really geared toward when you need to make a request for an assessment, that referral, how do you technically do that? One other thing that has come up in the other sessions is about, wow, 5 days. I'm a little nervous that maybe my person doesn't have a phone, or they're not going to answer the phone call. They screen calls. I think we all kind of do that. No one answers a phone number that they don't know. The nurse assessor is going to try mightily for several days to get a hold of that member. If they're calling, they're leaving voicemails, and really trying to get a hold of that member. They're going to be sending emails. We will, as Stacy mentioned, we would ask you to say, hey, this person is going to be calling or sending an email. They need to get this assessment completed. Warn them that this is really critical, that they respond and get that assessment completed. Getting that assessment scheduled is going to be key to making this timeline as short as possible and getting this turnaround back to you so you can complete the PAR process. And then one other question here I'm seeing, once an assessment is completed, how long is that in place? So typically it's good for the year. So you would see an assessment need to happen on an annual basis. We would do this at the time of the continued stay review. As noted, our hope is that in the future, you can have what we call that express assessment. And so you don't need to have this full-blown assessment completed if the person's needs are exactly the same and there's going to be no change in what services are being requested. But that's kind of that future state. But generally, this is going to be done once a year. And what you would tell your members is that the call is coming from intelligence. So you would say, hey, I want you to give a heads up, tell them you have to complete this assessment to have your skilled care needs assessed. You're going to be hearing from this nurse assessor. They are employed with Telligent, and they're going to be giving you a call or sending you an email. So that is who they would be coming from. Qualitrac is the specific IT platform that is used by Telligent. Any other questions, please put them in the chat and we can get to them as Stacy wraps up the slides.
All right, thank you. So our wrap up, just a knowledge check. So now that we've gone through this training, you should be able to log into Qualitrac using our MFA methods, understand how to access the Qualitrac provider portal, know how to search a member, and be able to navigate the referral request form. And then last is just some information for you in the event that you need assistance. Here is our email for the contract and the toll-free number to get in to talk to one of our support services. Any other questions, jump into the chat, or are we good?
I'm not seeing other chats here. If anyone wants to come off mute and ask any questions, please do. We welcome any questions you have. Otherwise, you can hold them. Please note that we will be sending out the slide deck and a recording of this training. It'll be posted on the Nurse Assessor webpage, the HCPF webpage, but we'll share those links and that information when it's done in the Case Management Corner newsletter, I believe is what that's titled. So please look out for those resources next week.
All right. Thank you all for your time.
Thanks all.